evening, everybody, and welcome to Nursing News Tonight. I'm Emma Grace Bridger, and tonight's special is on a new technology called hybrid operating rooms. Hybrid operating rooms are a new technological advancement that allows surgeons to combine multiple procedures into one minimally invasive procedure. This technology involved with this new innovation is what makes it so important. High-definition television screens mounted to the ceiling can upload a variety of results and images. Everything is very accessible, and patient info can be easily retrieved at any time during surgery. Let's go to a perioperative nurse named Hannah McLean to get some more information. Ms. McLean, thank you for agreeing to be here with us today. Can you tell us a little bit about how hybrid operating rooms specifically impact nurses?
Yeah, sure. Hybrid operating rooms allow nurses to explore new boundaries that they wouldn't be able to otherwise. They require more collaboration among nurses in order for procedures to be successful. This collaboration leads to less communication errors and more successful management of the patient. These ORs allow nurses to access patient information more quickly because high-tech imaging capabilities are present.
Awesome. Now, how do hybrid operating rooms apply specifically to patients?
Patients obtain many benefits from hybrid operating rooms. The use of these ORs in critical surgeries have proved to have better recovery rates and mortality rates than when compared to traditional operating room procedures alone. The collaboration among healthcare professionals in the setting of hybrid ORs decreases handoffs, which better helps reduce infection risk for the patient, and in emergency situations can prevent delays due to the already available equipment provided.
The effectiveness of the hybrid operating room is being demonstrated in various places across the country. 3 elderly patients in Cleveland, Ohio each needed a transcatheter aortic valve replacement, a TAVR, but their conditions of coronary artery disease made them unsuitable for TAVR in a standalone procedure. Doctors in the Department of Thoracic and Cardiovascular Surgery performed the TAVR along with a percutaneous coronary intervention in the hybrid operating room. The surgery was very feasible, and the patients experienced no morbidity and were released from the hospital in 30 days. These results are not regularly seen in such a procedure, therefore the hybrid operating rooms are accredited with allowing this outcome to occur. Research also shows that hybrid operating rooms significantly reduce the amount of radiation that patients and surgical staff are exposed to. One study published in October of 2015 showed that depending on the actual procedure, hybrid operating rooms could reduce patient exposure by between 73 and 76%, and that surgical staff exposure was also reduced significantly. As large amounts of radiation exposure have been proven to have harmful long-term effects on the body, there is a significant benefit of hybrid operating rooms to traditional operating rooms. So what other impacts do hybrid operating rooms have the potential to make on the medical field in the future?
Hybrid operating rooms require staff that knows what they are doing with the technology to operate them. Medical and nursing students could be taught how to use these new technologies in school, and this would better help them expand their depth of medical knowledge. Furthermore, doctors and nurses could begin to specialize in this area, which would make the procedures even more successful. Jobs for specialized hybrid surgeons and perioperative nurses would open up, expanding the medical field and the numerous possibilities within it.
Thank you for your time, Ms. McLean. All in all, hybrid operating rooms are looking to be a great alternative to traditional operating rooms in many situations as technology advances and they become more and more practical. It won't be long before hospitals everywhere begin to incorporate them. Once again, I'm Emma Grace Bridger, and thank you for watching Nursing News Tonight.